So my topic for today, surgery for a failing heart, giving patients a new lease of life. Some parts of it can be explaining a bit about what Dr. Sam also mentioned, and then we'll get to treatments after that. Okay, so in Heart Center, one of the benefits of being here is that we work as a team. Now all the surgeons here are independently capable of doing everything by themselves, but we work together so that there's cost coverage, so that everybody has input, and we make sure everything is covered well. So our senior advisor, Mr. Siva, we've got Dr. Tan, our current director, Dr. Chow, Dr. Chua Kim Chai, and myself, the current co-director. So okay, so in summary, as Dr. Samuelson already said, about 1 in 4 to 1 in 5 patients can develop heart failure in their lifetime. The worrying trends are that in Singapore, they tend to develop heart failure at a younger age than in the Western civilization. So we tend to happen about 10 years younger at the age of 61. The problem is that with heart failure, the hospitalization burden is high. So they end up being in hospitals for a long period of time with multiple readmissions. And when they're at home, they can have a lot of symptoms, breathlessness, and so on, like we said. What happens is day-to-day function, the ability to do your daily activities drops. And you have breathlessness, fatigue, leg swelling, and recurrent admissions to hospital. Some of the causes I mentioned, coronary. So the heart is made of muscle. Muscle requires blood for it to pump. So if you have blockages in the blood vessels, then what happens is the muscle can get infarcted or damaged, and then eventually it gets weaker and weaker and leads to heart failure. So that's one mechanism. Another mechanism is that, as mentioned before, the heart has got valves, and if these valves can tighten or become too loose, then the heart's not functioning very efficiently as a pump, and eventually the heart has to compensate. Over time, it can also develop heart failure. So this is another very important cause. Other issues are high blood pressure and diabetes, obesity. All these are lifestyle factors that can affect your heart. As mentioned earlier, whether the heart goes too fast or too slow, this can happen on its own. And some patients are unfortunately born with diseases of the heart muscle itself, so they become weaker over time by themselves, and that also requires treatment. So advanced heart failure is when symptoms happen at rest with basically minimal effort, recurrent hospital admissions, and as mentioned earlier, all your organs start to have issues. The heart's not pumping enough blood to the kidneys, the liver, the rest of your body. At some point, even medications are not enough, and then at that point, once medications can't help you anymore, the prognosis is poor, which means that your trajectory on how long you can live starts to drop. And that's when we need to consider what else can be done. So in terms of the heart failure journey, we have stable heart failure, and that's the initial, that's a start, where basic usual activities are still possible. Then if it starts to worsen, of course, there's medications and certain lifestyle modification that we can do. And then if it reaches advanced heart failure, we have to start considering all the other options. So in terms of, if you look at from bottom to top, lifestyle medications, lifestyle and medication advice given, as mentioned earlier. Other things like devices, sometimes we put a pacemaker. And moving forward, if patients have like blockages in the arteries and so on, then there are certain surgeries or stents that we can do. And in the last part, which we'll talk about, is when the heart really fails, and your only option is to either put an additional pump or to replace the heart entirely, and that's transplantation. So on the right, if you look in terms of blood flow, when you have blockages in the arteries, some of the things we can do are like stents and balloons, and in certain patients where required, then we talk about bypass surgery. So bypass surgery is where we have to put you to sleep for an operation, open the chest, have a look at the heart, and then connect, with the use of a heart-lung machine, we have to connect veins we've taken from the hands, the legs, and from the chest to bypass the blockages. And on your right side, you have a picture of the valve. So once the valve starts to get too tight, diseased, it needs to be removed and replaced. So that's a surgical operation as well. And at the bottom, if for example, the left side of the heart is the only part that's not working well, then you can consider a left ventricular assist device. And if in certain patients who are not suitable, or it reaches a stage where you need a heart transplantation, that's the other option as well. Now, a bit about the pumps. So we'll start talking about these are the HeartMate 2 and HeartMate 3 pumps. So the pumps have been around for a very long time, so more than 20 years. It started with the ones on the bottom left of your screen, very large, not very compatible, but still that was the only way at that time to prolong your heart function if your heart wasn't working well. And then on the top right, we have, if you look at the image over there, I have a pointer. The image over there, that is the HeartMate 2 pump, which we were using before, the latest version. It's quite large, as you can see. Essentially, it's an operation where we have to implant this pump into your body. We implant this cuff into your left ventricle. We suck blood out, goes through a pump here, and pumps it back to the aorta. And then we close the chest, we close the bone, and there is a wire coming out of your body near the abdomen here, which is connected to batteries, and that's how it sustains the pump to be working for a long time. These pumps can work up to more than 10 years as necessary, with proper medications and warfarin and some lifestyle adjustments. Now, with the latest technology, the newer pump is much smaller, much easier to implant. So it's a small pump, same place, and it sucks blood out from the left ventricle, goes through the outflow graft, and goes to the aorta. Okay, and goes still connected to batteries. There's nothing wireless as of yet. And otherwise, it's technologically very advanced. It functions very well. We have patients on it for up to 10 years. So what is the LVAD? The LVAD is a left ventricular assist device, a small mechanical pump that's connected to the left ventricle. We use it as a bridge to transplant. I'll explain a bit more about that later. It is powered by an external battery. It requires lifelong warfarin. But with this pump, patients are able to return to a reasonable quality of life, able to walk, able to work, and a lot of them even travel, as you'll get to find out about a bit later. Now, from the patient perspective, however, it does require surgery. You need some rehab and how to learn how to cope with the pump after that. Long-term medications like warfarin. There's a drive line coming out of your abdomen here, so that needs to be taken care of. You are connected to electricity and batteries. Things like swimming are not suitable, but you can take flights, you can eventually go back to work, school, and have a reasonable personal life and so on. So we'll talk about that a bit later. So part of living with an LVAD is you have, the pump is driven by power. You have to take care of the drive line, you're on blood thinners, you have follow-up visits, and we'll get to all that a bit later. Essentially, the pump is a method of prolonging life, and it improves your quality of life and reduces hospitalizations. The next option is heart transplantation. Heart transplantation is known as a gift of life. It's a gold standard, actually, for end-stage heart failure, which is when your heart is not working anymore. Started in Singapore since the 1990s. Now, the issues with heart transplantation are that it relies on having donors. And just to explain a little bit, in other countries, heart transplantation is a lot more common because of certain things like road traffic accidents, younger patients having construction injuries or things like that. Now, fortunately or unfortunately, our country is quite safe. We don't have a lot of road traffic accidents which are very severe. So the number of donors that we get is very low. So this is one of the limitations that we have for heart transplantation. And as a result of that, our patients who need a heart transplant end up waiting for a very long time, up to 3 to 10 years for heart transplants. So when we start talking to you about your heart failing, more often than not, there's not 3 to 10 years to wait. The medications can't provide you that quality of length of life. That's where the pump comes in, because the pump is readily available. It's a commercial device. Anytime we need, we can implant the pump while waiting for a heart transplant. And eventually, if a heart transplant comes, you're lucky enough to get a donor, which is matched to you and suitable for you, then we'll have to go for a second operation, remove the LVAD, put the heart transplant in, and at that time, you'll be free of any wires and so on. So in terms of heart transplant survival, the median survival is about 12 years, but the longest patients can last up to 20, 30 years with the proper medications and the proper lifestyle adjustments. Now, how do we do it? Heart transplantation replaces the entire heart with a healthy donor heart. As I said, the donor hearts are scarce. You will need lifelong immunosuppression, regular follow-up biopsies and tests and so on. Now, in terms of the pathway, we have to assess the patients, make sure that everything is suitable. They are then listed on the heart transplant list, so they are waiting for a transplant. And more often than not, if you can't wait that long, we need to have a temporary device like a LVAD support. And then eventually, if a heart transplant comes along, you have the heart transplant surgery. How do we do it essentially is we bring it to the operating theater, we open the chest in the center. It has to be done through a normal sternotomy. It can't be done through a minimally invasive approach. And we have to remove the LVAD, which would be there. And then basically, there's a donor in another hospital. For some reason, the brain is not working and so on. So if they are brain dead, then we'll open their chest, remove their heart, bring it to our heart center, and then essentially we will remove your heart and implant the donor heart. With certain medications, with certain pacing wires, certain procedures that we can do, make sure it functions well. Then we check there's no bleeding, we close the bone, close the skin, you go to ICU, and we start the recovery process. We'll get to any questions later. Now, how do we choose? As I said, unfortunately, in Singapore, heart transplants are quite rare, infrequent, so it's really precious to us. Patients who can't wait need to have the pumps put in beforehand, so that's one of the ways that we choose. Now, other issues, both are required for advanced heart failure. The benefit of the LVAD is that it can be done without waiting. The benefit of the heart transplant is that you don't have a wire, right? So no drive line. Heart transplants require immunosuppression, as you can see. There is a risk of rejection and infection and so on. But for the LVAD, you have to live with the drive line. You have the risk of infection from the drive line. You'll be on warfarin, which is a blood thinner. So these are all other issues that we need to consider. Now, from referral to recovery, we'll talk about this a bit later as well. But essentially, once we find out you have heart failure, you're assessed by a multidisciplinary team, which involves the cardiologists, the surgeons, our transplant managers, who play a very big role in taking care of everything, as well as the pharmacists and physiotherapists and so on. We decide what needs to be done, you go through the procedure, and then, of course, there's the long-term care. Take-home messages. Heart failure is unfortunately very serious, but it can be treated. Essentially, initially with medications, with lifestyle modification. Ultimately, for certain patients, the heart is still not going to recover, and it can worsen, in which case we need to consider if there's anything else we can fix. If there's nothing that can be fixed in terms of your bypass or your valves and so on, then we need to consider replacement or the additional pump, which is what we mentioned earlier, the LVAD or the heart transplant. Avoidance of these has severe consequences. One of the issues that we face is that patients try to hold off. Eventually, when their heart fails, the kidneys fail, the liver fails, everything else fails. And when you come in, you may not be actually suitable for a major operation. So there's a bit of a conundrum that we have to operate early enough when we know you need it, and not too late, because if it's too late, then you're very sick. You end up being in hospital for much longer, may not survive the surgery, because the surgery itself is major surgery. Our aim is to prolong and extend life, to take care of good quality of life as well. So our aim is to get you back on your feet, get back to your activities, and have a reasonable quality of life. The last point is that we work as a team. It requires all of us together, as well as the patient's cooperation, for us to have a successful approach. This is before lunch. I'm going to show a bit of a gross picture, so I do apologize, but I'm sure you watch dramas and all that, so you probably would have seen this before. Okay, so one of the things we do in Heart Center is in Singapore, we send our doctors overseas for further training. So this is just to talk a bit about my experience overseas, where I was there for a year in the UK. It is such an amazing gift that the UK and Europe have a service where they actually take hearts from each other, right? So if the heart for Germany, for example, is suitable for a patient in the UK, we would go and fly in these small planes that they would pay for us. There's about 6, 7 of us as a team with all these devices, go over to Germany in a high-speed ambulance, after the plane, ambulance, then to the hospital, retrieve the heart, put it on a device, and then come back to the UK, and then transfer it to the implanting center. So it's really amazing to see that, one of the things we got to see. So one of the new technologies that was used is that we used to only take the heart out and put it in a cold ice box to preserve the organ. But now there's a portable version of putting it on a heart-lung machine, which allows for the heart to pump. Can you see? Can you play the video? Cannot play the video. Okay, it's okay. Video is supposed to be there. Basically, the heart pumps in a box, so it's quite interesting to see. But you can see on YouTube and all that as well. Thank you for your attention. We'll have question and answers at the end.